Emer, you're live.
Hey guys, it's Dr. Emer and it's our Halloween filler treat today with one of my beautiful patients. We're going to be doing female facial sculpting, and I love doing this because you don't have to do it that often. When you do it, you get a significant improvement that typically would last 6 months to a year. I find that at about that 3 to 6 month time period, you start to notice some of those lifted areas coming down and some of the folds starting to reform unless we're doing long-term collagen stimulation. So then we have our patients come back and we do our little tweaks. So today, she already looks great, but we're going to do some tweaks to give her some lifting in the mid-face, some lifting in the brow, definition along the mouth and jawline, and just make her look a little bit better with softening of the fine line. So I usually start from the top. Lift your head up for me, because I want to get some lifting here. I'm going to go into the temple area, little pinch going all the way down. It feels weird and it sounds weird, but this area is a very safe area to inject. We're using Radiesse, which is a calcium-based filler, because one, it gives a lot of volume and lift for the filler itself, but also it does build collagen. I mean, I feel like she's not aging since we've seen each other over the past year, which is good because all these things we've been doing have been enhancing her look and building collagen.
People are saying that they love the Superman costume.
Oh yeah, so you guys all voted. Superman or Frankenstein. Here I am today, Superman, showing off my abs. Okay, so we're gonna do that same thing. Remember, people always ask me, why focus on the temple when people don't really notice it that much? And the thing is, it's about subliminal beauty. It's about making sure that we keep you looking young by perception of yourself and others. This helps also lift the brow itself, so you don't get that sagging as much as time goes on. I'm going really slow. The slower you go, studies show that there's much less bruising and swelling. And again, we're in a deep plane here to give her a nice, safe improvement.
And I like his eyes are gorgeous.
Thank you.
The beautiful eyes yourself.
Oh no, his are like, I want everybody to know this does not hurt.
Okay, lift on up. So now we've done a little bit more in the temple. I'm just going to do now through the OG curve. We're going to start lifting the cheek a little bit. The goal is to do more lateral lifting for her. We're going to go really slow, small aliquots on the bone, very little bits to just give some lifting laterally. And what this is going to do when done well is not only enhance her cheekbone, but soften through the folds, of her nasolabial folds or her smile lines, which will also inject a little too. But this helps give a nice lift, and you don't need much of it, which is great, but the key is that you're in the right place. We're going all the way down to bone, going lateral, and we're lifting and blending this into the temple. So now this all blends nicely together, and this is called the OG curve, not the original gangster, the OG EE, which is a sign of beauty. I know everyone always asks me that. Like, did you create that name? All right.
Who? OGE?
Yeah, OGEE. It stands for this area right here that we want lifted. No, there's no. It's the actual name. Yeah, it's an actual name. OGEE. It's defined by a couple doctors. And we're doing that same thing here. We're just doing very subtle bits along the bone to give her lifting. I find that too many people do too deep in the mid face, and then when they smile, they look very full. We don't want that. We don't want to hide her eyes. We want to show her eyes. And we can do that by accentuating her laterally and lifting.
Dr. Emer,
Yeah.
do you usually use Radiesse when the patient has had voluma in the cheeks before?
You can combine both. If somebody likes the look of voluma better, you can totally use the voluma. Voluma has a softer look. It doesn't hold the face up as much. Look up a little bit here. So now the next part, we're going to go to the back of the jawline, and we're going to just do a little bit at the 90-degree angle. This is going to help lift her jawline up. Turn a little bit this way, following the chin, or start following the jawline towards the chin. We're going to define this area slightly. not much needed. And this will help lift the jowl, even though it's so far back, it helps define everything over here. So you can see already, we start to lose that a little bit as the skin gets looser. And this will allow her to have more shaping. And then one thing is you always want to do a little bit to the submalar area, a very small bit. And then a teeny bit we're going to do right in the pre-gel sulcus to give her a little bit more definition here and through the marionette area. Good.
How long does Radiesse last?
Radiesse lasts about a year to a year and a half, 12 to 15 months. The collagen production is really high. So I like it, but again, it's one of those things where some people don't because it can't be reversed. So you have to really trust who you're injecting with because this is calcium based and there's no enzyme. We're doing very small bits, you guys, just to make sure that it comes out perfectly. We're following the jawline. A little bit right at that 90-degree angle. Very good. And then again, that submalar area, I'm just going to go a little bit right by the apple of the cheek, small amount. And then the pre-gel area before we go to the chin. Give her a little definition there. Now for sculpting, we're going to give her a little bit more prominent chin because this is again around the mouth. This will help not only the folds around her mouth, but also the folds on the corners of her lip. So we're just going to do a subtle bit. We're going to start in the middle. Do very little bits at a time. Right on the bone. Give a little projection. Good.
One of the areas of concern I have
is the crease.
Is that crease there?
We're going to address that in a minute with a filler that's layered on top.
Oh.
Don't worry, I got that ready for you. Called Belotero. So this is going to give the structure that we want here. And then the one I know you don't like that crease there or the fold kind of around the mouth, that's going to be where we use the softer filler. Because you don't want a really thick filler right under the crease there. It'll look too puffy and unnatural. You guys see already, look, what just volume loss around the mouth does. So now when we revolumize, you can see how much more improvement there is. How much more improvement there is here.
Oops, this is not a word you want to hear.
No, but it wasn't with the needle. That's the
Can you
important
edit
part.
that out?
Can't edit a lot. I know. But we're switching here. Pause. Okay. So now we'll finish the opposite side, because now you see you guys here, it's much more angled, looks more softened. We're just doing little bits right here along the bone. And now we're going to soften the folds. Some people don't even inject the folds anymore, but in some instances we actually really would want it. So we're just going to do a very small amount, not a big amount at all. We did the original clinical trials with this, we did about 0.7 to 1.2 per side of fold. Here I'm doing about 0.3, very little. Just to soften everything. And then last little bit.
How are you feeling?
Fantastic.
Good.
Because I know that I'm getting an improvement. It doesn't hurt.
So you guys see now, this is much more contoured here. We're going to go give her a little bit to the fold, like we said, not too much, just a small amount, just to build collagen there. And give her a little more lifting here. so good. Bruising. Not much.
And then what can we do to reduce bruising
Well,
afterwards?
there's a lot of things. We can do red light therapy, which we're going to do right afterwards here. We can do vitamin C pills, arnica and bromelain pills, icing. You don't really want to massage too much. Aggressive massage has actually been shown to increase the bruising. It's firm pressure that actually really helps.
And how long does the bruising last usually?
1 to 2 weeks, just depends. Everybody's different. We're going to go a little higher on the temple here. Great.
And I do want to say that I was on 8 milligrams of Advil, an anti-inflammatory, for 6 weeks due to an injury. That will increase the bruising.
So right now we don't see much. So now we're going to work on those creases that you were describing. So we're switching now to a different filler called Belotero. This is a very soft filler. And you see all these little lines. This is where we want to focus. With this filler, we go a little more superficial. She won't feel it too much because she already has some of the other filler layered underneath. But we're going right into the line. And we're just softening the line and the creases. This filler is designed for fine lines, but I'm going to use it a little bit to soften some of the sagging, a little bit of looseness through here. And we're also going to improve a little bit of lines around the mouth, so just bear with me here.
How many are you using for the whole face?
Right now we're on 1. Oh, we did 5 Radiesse already. We're going to do 3 Belotero. And you see, I'm just placing this very superficially into the lines here. It doesn't feel great. She's doing really good though. And also a little to the corner of the eye, because that helps as you age. People lose a little volume here. Right into the corner. And we're going to blend again the OG curve. And then also this crease that she doesn't like under her lip, which we'll address in a second when we do the lip filler. We're almost there. Now we're going to go to the opposite side. So it's not about line filling. If you guys see already, she's lifted now here. Can you hold a little pressure right here for her? No, she'll get it. It's not about line filling. It's about softening. Doing very small amounts. And this area is called the lower cutaneous lip. We're trying to just soften where people lose volume, a little bit into these fine lines here. She's going to massage with the Q-tip on the upper lip where those lines are. With Belotero, we're literally going into a lot of these little lines here, guys. The superficial lines. Doesn't feel the best, but it really helps. This is the only filler that integrates directly into the superficial part of the skin. So you can see now, even with these little injections, she doesn't see the wrinkles as much. So we're gonna just do a little rolling.
Which Belotero are you using?
Well, in the United States, there's only Belotero Balance. There's no other Belotero in the US. Canada, they have many. Europe, they have many.
Why isn't that?
FDA is very annoying when it comes to trying to get things approved. That's why. That's unfortunate.
People are saying hi from Brazil.
We love our people from Brazil. So we're saying hi back. So I'm doing a little defining superficially along her chin. pre-gel. So it just looks a little more defined. Great, so she'll massage over there now.
Isn't it great watching him? I don't even know who we want. Jenny.
Sorry, nice to meet you.
We're almost there, guys. It looks great so far. This will be a little
Could
slow.
do this all day.
I want you to. And now I'm going to follow again, just along the jawline again, softly. Fine wrinkles, we're going to just soften there. So the pre-gel looks more defined. Look up a little into your right. Now look, you can see the jawline. There's potentially maybe a little bruise developing right there.
How long does Belotero last?
This will only last about 6 or 9 months. This is what I call the finishing touch. This is the soft filler that keeps everything blended. And it's going to make her look much more defined. She's going to love this, I can tell. She's going a little more into the fine lines. Good.
Are there any other treatments that we can do to treat the fine lines?
Oh, of course. We can do lasers and peels and microneedling. There's so much. You guys follow my YouTube channel. You'll be able to see. But we're starting today with sculpting. She's going to be super happy with it. Okay.
Somebody's asking if Belotero is hyaluronic acid.
It is. It's a very soft hyaluronic acid.
And is it good for under your eyes?
It's great for under the eyes. That's what I'm going to do. 2 little pokes in a second. So we are doing a little to the lateral eye, because that's where everybody starts to lose volume. But remember I said her mid-face is already pretty full, so we don't want to add too much. 0.1 to the under eye and a little massage is all she needs there. Jawline is defined.
Can you lift the corners of the mouth with fillers?
We try. It's going to look too puffy if we do any more than what she has. So now we got to try skin tightening at this point. Morpheus treatments, threads, etc.
Do you ever use Botox?
We can.
With the X to those corners?
Yeah, you could use a little Botox in the corner. I did that already this morning. I think for you, because the majority of it is laxity and not movement, would be a little better.
Laxity.
Soft.
That
All right.
makes me feel.
I know. Ice pack your
Well, it's
lip.
Halloween. Laxity is a good thing.
That's true. Ice pack your lip a sec, because we're going to go to your lip now. Because everything looks great. Obviously, there's a little bit of swelling, nothing crazy. So now we're going to go to Jupiter Velour, which is one of my favorite products. It gives a little bit of volume, but it's soft. So it's going to look really nice. The fine lines have been filled. They'll soften over the next 2 weeks. Let's start with her lower lip. Go ahead and look up. Now she already has a little natural asymmetry, and her lip has an inward turn. So we don't want to go too aggressive with trying to bring this forward, because it'll just make her look really big. We don't want that. We just want natural. But I want to try and balance it, because one side is very different than the other. Good. Close for a sec. So you see how the one side, even without filler, looks already more full. So we'll get it a little bit. Balancing it out. You see how now we brought it down a little bit, you guys?
Mm-hmm.
And it looks a little more even now.
It really does.
Okay. The biggest thing for her is at least giving her some definition. So I'm going to come on that side. We're going to start with creating a little bit of a cupid's bow. So to do that, I'm going to grab right here, a little pinch, 1, 2, 3. Okay.
Does this technique have a name?
No. We just want to create some volume here. And at least will give us some shaping. Now, this is called a pillar technique. This helps do more inversion. So you see how we're able to lift our lip there by doing that. Although, you know, there's only so much you can do. You don't want to fight it too much. Otherwise, that makes for an unnatural lip. And she doesn't want.
Do you prefer velour over Volbella?
I do. But it's basically the same thing. Velour is Voluma plus Volbella. That's basically what it is. It's a mixture of the two of them. So it's soft, but also has the ability to produce some volume, which we need for her. If you only wanted softness, then yeah, we do Volbella or Restylane Refine.
How do you avoid the duck lip look?
Technique. Technique, not using the wrong type of filler. So you don't want one that's too robust for somebody like her that just has a soft lip.
Do you prefer Belotero over Restylane?
For fine lines?
Yes.
Yeah, I do. It doesn't last as long though. It's only negative. But it does, I think, looks better. Almost done. Going a little bit back and forth because I'm making sure it's as perfect as we can get it. And you keep releasing this here to make sure that it's in the right plane.
What filler is this again?
This is velour, Juvederm velour. I want to give her the pink show a little bit. And then I would tell her to use a lip plumper to help keep it swollen looking naturally. Good. So that she has a little more plump every day. Because otherwise the only other option is a lip lift. But for her, it would actually be very short if we did. It may not look as good. This looks really great, guys. So if we take a look, we're going to do an Emer reveal in a second. Lift it through the cheek area. Much more defined through this pre-gel and chin. Soften the crease, give her a little bit of lift, soften the folds, filled out the OG curve and definition in the 90-degree angle. You want to do an Emer reveal?
Okay, give us 1 second.
You don't even look like you're gonna bruise. You don't even look like you're gonna bruise.
Alright, are you ready?
Alright, so take a look at yourself. Hold the camera. Hold the phone. Now kind of look at yourself and tell me, what do you think? Obviously when you're swollen, you never know. Where's the camera?
I think there's a nice improvement.
So see, look at your jawline. Turn this way,
Yes.
look.
Yeah.
Right here, 90 degrees. Lift it through here, almost no pre-gel. Look at your filter columns. You wanted those.
Yes, I did.
Now you have them. Lift it up through the cheek area, lift it up in the brow, and it looks natural. What do you think? Happy Halloween. Well, no, I would have been bad if I gave you for Halloween. But now take a look in the actual mirror, like the other side, and take a look at the angles now. Look up just a little bit. So that is female facial sculpting, you guys, doing basically full facial rejuvenation, something you would do once or twice a year, and then you would tweak in between.
Oh my God, look at the jawline.
I know, it's so much better.